starting to create a checkpoint. So in California, for example, is the only state, and then in Canada as well, where they've defined that veterinarians can specifically discuss cannabis with their clients and essentially which are their pet parents about their pets. And so it sounds like a small, minute advancement, but to be able to discuss in your office, in your practice, is probably insanely helpful. I'm not licensed in California, but I'm licensed in many other states, but essentially to finally be able to clear some conscience for both sides and to allow for some type of direction to go. That's going to be helpful. And I think that there's a number of floating around by 2021 that there's going to be another advancement, such as being able to potentially recommend products that are trusted and safe. That's where we're leading. But again, it's a slow process when we're working with governmental and private entities that are trying to be weary that there are things we need to answer first before we go forth and allow for use in other areas.
Do you know about any studies that are going on right now that any that give you any hope, or are you excited about any studies that have been talked about or that that are in the process? Can you talk about something like that?
Yeah, so 2018 was the year that we finally started to get some great objective studies in veterinary medicine. But as you touched on before, these are studies that occur in a research setting. So they're normal animals, and they're being given a stimulus, and they're being given a drug essentially. And it can't be considered a drug yet, but it is essentially a medicine that we're testing. And so at Colorado State and Cornell was where we got our first two studies from, and they were on seizure control and on chronic pain for arthritis, respectively. However, at the same time, like we touched on before, these are not real life situations. So the doses they use in those situations may be different than what we need in the normal setting, especially if dogs are using it for multiple conditions.
Like if you have a dog who has a seizure malady, they're not using dogs that have seizures to test the product.
Yeah, so there was another study that came out in 2019, actually, with dogs that were having seizures that were already on other anti-epileptics. And then they started to add cannabis-based therapeutics in as well. And so that did show some really positive results in terms of being able to combine with medications that are being used, such as the classics are phenobarbital, and then potassium bromide is another one, et cetera. There's a couple more we use. But essentially it showed in that study, which was really impressive, was that it didn't, in the short term, affect the amount that was circulating in the body, and it didn't cause any specific adverse effects to occur. So we have prospective studies coming out. They're short, but they are a guiding light that there's a future that's very bright for us.
Wow. So, I mean, I think a patient or a pet owner right now can look to a couple of years. How long do you think it'll take for some of this to be extrapolated over the data that can be used to then actually dispense? Well, I guess a patient parent or a pet parent can go ahead and do so on their own.
Right.